Hello, my name is Dr. Tim Young. In the next 5 minutes, I'm going to cover 5 key points about why we should bother about headaches. I've been a headache specialist and consultant neurologist since 2009, and I'm currently working as a course co-director and a lecturer at the Queen Square Institute of Neurology, UCL, London, England. You are most welcome to this video, whatever your background, even if you already know quite a bit about headaches, but it's predominantly aimed at those who don't. This may be you. Perhaps you're a doctor who's a busy specialist in your own field, or maybe in the past you haven't been interested in headaches, or just possibly, to use this dinosaur analogy behind me, in the past you've rather run away from headaches, fearful that it could be a harbinger of a sinister secondary cause that you wouldn't want to miss. I'm going to go over my talk with 5 key points which I'll briefly look at here and then look at in more depth shortly after. My first point is that headaches are common, extremely common. So common that tension type headaches are actually ranked as the second commonest illness in the world, with migraines being the third. That is common indeed. Impact of headaches is next. They cause a lot more impact than is often given credit to them for, and this is not just to the individual, but also to their social networks and even to the economy, as I will mention later. My third point is that, yes, there are scary secondary headaches out there, probably not as common as many patients or even some doctors fear, but they need to be respected. And in the latter part of my talk, I'll mention the name of a tool that can be used to help look for red flags for these. Next, we come on to the management of headaches. Now, management is not just about treatment, it's also about making a diagnosis, which is often not quite as difficult as you might imagine. And this is an important factor because all doctors will see headaches. So if you're a doctor, this is relevant to you. Let's cover these points again in more detail. First point, how common are headaches? Well, let's look at this by imagining the world, and incredibly, with over 7 billion inhabitants, every year on average, you would expect approximately 2 billion people to suffer tension-type headaches, around about 1 billion with migraines, and around about 60 million with medication overuse headaches, the latter of which, in theory at least, should be largely preventable. You see that I've referenced my talk if you do want more information. Now let's consider migraine. Migraine, which is the leading cause of disability from headaches worldwide, reflecting both its impact and its commonness. If we look at migraine around the world, some people might think, well, it varies a lot from place to place, but probably not so. If you look at these figures here, you'll see that wherever you are in the world, roughly speaking, at any one time, around about 1 in 10 people might be having relatively active migraines. My next point concerns impact, and I think sometimes people are slanted away from the real impact headaches can have because they think of tension-type headaches, which so many of us will experience in our life, but which are typically quite a bit milder than migraines, or even rarer conditions such as cluster headache, which can produce pain among the most serious known to man. So let's think about the iceberg analogy here. If we think about the iceberg, you know the analogy, you see a little bit on top, you don't see a lot of what is beneath the water. It's similar with headaches. We don't often see people suffering from headaches. They would typically retreat, in the case of migraine, maybe to a darkened room, out of sight, out of mind. When we think about the economic impact, incredibly, migraines alone probably cost the US economy $13 billion even 20 years ago. Actually, a lot of that comes not from the obvious fact that people stay away from work, but that they come into work and can't perform at their best, so-called presenteeism. A brief word again about scary secondaries. There are tools to help you look for red flags to help filter these out, such as this Snoop T and others, and they can give you more confidence in trying to tackle this. When we think about management of headaches, it's not just about treatment, it's also about diagnosis. And sure, some cases can be very difficult even for specialists, but so often diagnosing primary headaches such as migraine, tension-type headaches, or even cluster headaches, or secondary headaches like medication overuse headaches, is not as difficult as you may think. That can help put the whole management plan together. And it's not just about more medicines, although many great ones are out there, just to name some: triptans, calcitonin gene-related peptide monoclonal antibodies, and many others. Often, less is more. When first seen, around 50% of people with chronic headaches may have medication overuse headaches as a factor which will often need to be treated as the first priority. I hope that you found this talk useful. My final point, just to emphasize that all doctors will see headaches, so if you're a doctor, this is relevant to you. The International Headache Society are planning a short series of videos, a bit like this, that will hopefully help you find out a little bit more. I'm really happy that you took the time to look at this video and hopefully want to find out more about headaches. You can make a huge difference to the many people suffering from headaches worldwide. Thank you.